Infection control for the dental assistant. So this is one of the longest lectures, so hang in there with me because it is actually extremely important information and it is required for your certificate with your state. So let's dive right in. Infectious diseases and disease transmission. So it is extremely important to know whether your patient actually carries any transmissible diseases. So first off, the patient medical history is an invaluable document, but it is not reliable as the sole method of identifying all infectious patients. Diseases with particular potential to actually spread in a dental office are Hep B, Hep C, AIDS, herpes simplex, and tuberculosis. First off, the definition of a disease is an organism's method and response to some type of injury. A disease typically is caused when some form of cellular disorder or function occurs. Diseases that have the potential to spread in a dental office, as we said, are tuberculosis, which is a disease of chronic inflammation. So diseases that spread in the dental office, as we said, were tuberculosis, herpes simplex labialis, Hep B, Hep C, and AIDS, HIV. So tuberculosis is a disease of chronic inflammation caused by the Mycobacterium tuberculosis. It's transmitted by the inhalation of airborne droplets, blood, and saliva. So proper utilization of personal protective equipment, or PPE, and proper disinfection of contaminated surface will protect the dental professionals from exposure. Herpes simplex labialis, or HSV-1, is a disease that causes painful lesions around the mouth and lips. These lesions are comprised of serum-filled blisters, or vesicles, which will eventually burst, ulcerate, and scab over for a period of time, about 5 to 10 days. These lesions are infective until completely healed. So utilization of PPE, again, and avoiding direct contact with these lesions will help protect the dental care professional. Hep B, or HBV, is a true risk to dental professionals due to this ability to spread. It can be transmitted by bodily fluids other than blood or saliva, such as semen and vaginal fluids. The dental professional must be protected by getting the HBV vaccine, proper use of PPE, and disinfecting all contaminated surfaces. Hepatitis C, or HCV, is the chronic liver disease that can be transmitted through blood transfusions, contaminated sharps, sexual transmission, and from infected mother to infant during childbirth. The dental professional can be protected by, again, PPE, disinfecting contaminated surface, and being very prudent not to get stuck with contaminated dental instruments or sharps. So AIDS, HIV, is caused by sexual contact, contaminated sharps and needles, and again, mother to infant via childbirth. The dental professional can be protected from the disease by proper use of PPE, disinfecting contaminated surfaces, and also being very cautious with dental sharps during dental procedures that are dealing with HIV or AIDS infected patients. So personal protective equipment, or PPE. Boy, we have talked about that a lot already, but you should definitely know what this all stands for. So it's designed to protect all dental healthcare professions, their skin and mucous membranes from blood, saliva, and other potentially harmful infectious materials. So according to OSHA, PPE should be applied in the following sequence: eyewear, face mask, and then gloves. Gloves help to minimize cross-contamination from patient to patient, patient to dental professionals, and from dental professionals to the patient again. So gloves should be worn during all intraoral dental procedures or when handling objects that have come into contact with blood or saliva. According to the CDC, standard precautions should always be taken. So in other words, treat every patient as though they were the same and had an infectious disease. So as we said in the beginning, that's why health histories don't tell the whole story on patients, so it's important to use standard precautions for them all. So types of gloves, I'm going to let you read through those on your own, but the examination and treatment gloves are the ones you'll mostly be using during every procedure. Protective garments can be either disposable or reusable. Disposable are gowns that are usually of about knee length, made of fabrics that resist moisture, breathe, and serve as an effective barrier. These gowns are discarded daily and thrown away. Whereas reusable gowns are what your lab coat is, and they're usually used of a reusable cotton or cotton polyester blend, and it's the responsibility of the employer to actually launder these reusable protective garments. If this garment is going to be transported away from the workspace, it's important that it's in a leak-proof container and taken to the laundering facility as a biohazardous material. The other part of PPE is face and eye protection. So face masks, as we discussed, should be used and have a 95% bacterial infiltration efficiency. Strongly discouraged to allow the face mask to hang from the neck or just be pulled down over the chin with different patients. Once it's used, it is contaminated and should be never reused after being splattered with blood or saliva. Protective eyewear is also extremely important as it shields the dental professional from blood splatter, airborne contaminants, or any caustic agents or projectiles. OSHA requires that protective eyewear have both front and side protection with solid side shields. Face shields can also be used as a substitute for the face mask and can actually be used as a substitute for eyewear as well. So occupational, educational, eye and face protection standards. Principles for personal hygiene and PPE say that personal hygiene and PPE is important for dental care professionals to be aware that they can potentially carry infectious agents from patients to patients as well as to other family members and coworkers and members of the community. Personal hygiene principles that decrease the potential of this cross-contamination include keeping your hair pulled back so it does not fall in front of your face during procedures in the operating field, keeping your nails clean and short, uniforms that have short sleeves that are short enough that you can easily wash your hands and forearms, and then an overgarment that's put on top to cover those areas that are susceptible to being sprayed or splashed with fluids. The overgarment should always be removed prior to leaving the dental office and laundered at 140 to 160 degrees. And jewelry such as watches, rings, and bracelets should be removed prior to donning your PPE. It's impossible to remove bacteria from these little areas due to all the little nooks and crannies, and potentially infectious microorganisms can hide in jewelry. Proper hand washing techniques is also extremely important to decrease the possibility of cross-contamination. I'm going to let you read about the proper hand washing techniques listed underneath C, including the types of soaps to use and the actual procedure starting from removing all your jewelry all the way to actually putting your gloves on. Now realistically, you may not be able to actually do the proper hand washing technique in between every patient, and we'll discuss that later and you'll see in your lab. But it is important that at least a few times a day you're doing the proper hand washing technique to ensure that you've truly removed all microorganisms. So for infection control, it's imperative that the dental assistant is in compliance with correct infection control. Utilizing proper barriers, correctly decontaminating all surface areas, and of course, using their PPE appropriately. There are government regulating agencies that actually mandate these things, such as OSHA, a federal agency, and the EPA, which is also a federal agency that makes sure that both the workplace and the individuals are safe in healthcare facilities. So types of hazards in the dental office include biohazardous and hazardous materials. Biohazardous materials are potentially infectious and capable of causing disease. That includes sharps, materials or instruments that are capable of actually cutting or puncturing the tissue. Needles, endodontic files, broken glass, scalpel blades, things like that are biohazardous. hazardous materials have the potential to make the workplace dangerous or less safe if they're presented soiled and discarded. So you can have things such as flammable things, corrosive, toxic, chemicals and things like that that are hazardous and have to be disposed of correctly. Infection control guidelines, general guidelines say that to sterilize any equipment that can be sterile, use barriers whenever possible to prevent contaminated surfaces, and then utilize disposable things when possible to save time and decrease the possibility of contamination. Another infection control guideline includes use of barriers. So these are those disposable plastic barriers such as chair covers, dental light covers, water syringe covers, tray covers, and self-stick barriers that can be used and thrown away after every patient. Patient barriers you're going to put on the patient include patient napkins, protective eyewear, a dental dam as well that help to actually prevent the patient from having contaminations. And then, of course, as we've said before, PPE, gloves, face masks, eyewear, and our protective overgarment are also important. So as we said, biohazardous waste disposals, it is important to take items that are contaminated and can cause disease. They must be discarded in clearly marked biohazard, leak-proof bags. So these biohazardous materials can include extracted or removed teeth, blood-soaked items, and sharps. Those need to be in a puncture-proof biohazardous container. There is non-regulated waste that can also accumulate during procedures, and these items are considered enough to be biohazardous enough to not be thrown away with regular trash, but they do have things like plastic barriers, covers that might have saliva on them and should be considered non-regulated waste. So that's also masks, eyewear, bibs, things like that. Now you may have hazardous chemicals such as mercury, formaldehyde, gypsum, things like that that can be in a dental setting, and those often have specific places to be discarded as well. OSHA has standards for how we do things, including a procedural manual that all offices have located in them as well, and then MSDS sheets which tell you if these actual hazardous materials landed on your skin or eyes, how you would take care of them. OSHA regulations for infectious waste materials. The regulations developed by OSHA for infectious waste are designed to protect employees from being exposed to things such as hepatitis B and HIV/AIDS. So these include biohazard labeling, such as warning tags that are intended to prevent accidental injury or illness or exposure. Training requirements. OSHA does require that employers provide training for all employees that are in occupational exposures. These trainings have to be annual and free of charge to the employees. Disinfection is also mandated by OSHA, and it includes the process of killing bacteria through the use of chemicals, an ultraviolet light, or ionizing radiation. So bioburden is the blood, saliva, and contaminated debris. Surface disinfection is the use of chemicals to remove this bioburden. Chemicals should not be rinsed off, such as iodoforms, hypochlorite, sodium hypochlorite, and phenol compounds. There are also immersion chemicals that can be used. Not recommended to immersion of disinfection is alcohol and ammonia. Those are not suitable. Procedure for disinfection includes EPA-approved surface disinfectants on equipment and working surfaces, vigorously wiping to decrease the number of microorganisms, utilization of optimal materials, and then using the spray, wipe, spray technique. It should be done in the order listed there in your handout. We spray the surface to be disinfected. We wipe vigorously with a paper towel, sponge, or 4x4. We spray again with a saturated plastic sponge, paper towel, or 4x4. We allow it to dry for 2 to 10 minutes as said on the bottle of material. And then we transport all contaminated instruments as soon as possible following the dental procedure to our lab. All of these transported instruments should be transported in a leak-proof container with a solid bottom and solid sides. Every attempt should be made to transport as quickly as possible following the procedure before any of the soiled instruments have time to actually dry. Once we are in the lab and we've removed all of these instruments and all the bioburdens, we've sprayed the laboratory, the operatory. We then hand scrub these instruments prior to the ultrasonic cleaner that will be used. Instruments should be hand scrubbed in a basin of soapy water with a long handheld brush. After they're scrubbed, they're rinsed in cold water, keeping splashing to a minimum, and instruments should now be dried with a paper towel and prepared for sterilization. When you do your hands-on lab portion, your instructor will actually show you how to go through the sterile line. We then use ultrasonic cleaning, and we utilize a process called implosion or sound waves in this ultrasonic cleaner to collapse the little bubbles onto themselves in a special solution. The mechanical removal of debris, called cavitation, allows the ultrasonic to reach areas that hand scrubbing cannot. So once the ultrasonic cycle is complete, the basket containing these instruments is removed and rinsed underneath cold water. Any instruments still containing debris should be manually scrubbed again. The disinfecting agent inside the ultrasonic cleaner must be changed once a day. That's important to remember. So your ultrasonic cleaner is changed once a day. Processing of instrument cassettes. So in many practices, an instrument cassette takes the place of these procedure trays. These cassettes are placed in the actual ultrasonic cleaner and then completely submerged. An enzymatic cleaner is used to help once again dissolve that bioburden. It's rinsed off with cold water once removed from the ultrasonic cleaner, and then you have to actually open the cassette and make certain that all the instruments inside are actually clean. We then begin the actual sterilization process. So this is after we've hand scrubbed and we've used the ultrasonic cleaner. We then put in the sterilization process, which is the autoclave, chemclave, oven, whatever your office uses. We then actually place them in these autoclaves to then actually sterilize the instruments. It's important to package and label all instruments correctly. They should be packaged loosely enough to allow steam to penetrate, and instruments should be pre-packaged using bags or wraps prior to putting them in the sterilizer. It's important to label the contents of the package and actually put the date stamp on them as well. This date stamp allows us to know exactly the date that the sterilization has occurred. Once these packages are sterile, storing them in unwrapped bags, wraps, trays, or cassettes should be in a drawer or cabinet until ready for use. Sterile packages will remain sterile for up to 3 months if well protected. Monitoring has to occur. So due to the possibility of equipment malfunction as well as human error, it's recommended to monitor and record sterilization methods at least once per week. There's 3 methods for monitoring: process indicators, biological monitors, and control indicators. So these are placed actually in the autoclave or chemclave to ensure that the sterilization process is actually occurring as we want. And with this method, a little strip of paper that is impregnated with little spores is actually placed in there. It's put in the center of the load, and an entire completion of the cycle is done, and once it is successful, no more spores will live on that little test strip. We send those indicators into a lab to actually be processed to ensure that all spores have been killed. It's important to do this about once per week. There are reasons that there will be a failure of this biological test, and that can include improper cleaning of instruments, excessive packaging, overloading the sterilizer, equipment malfunction, timing errors, and improper temperature. But it's important to know, as we said, that every piece of equipment is functioning to kill those spores on that strip to ensure that all the instruments that we're using in our patients' mouths are clean and sterilized. Bloodborne pathogen standards. So, developed by OSHA to protect healthcare workers, particularly in a healthcare facility. So this standard applies to all occupational exposures to blood or potentially infectious diseases. So OSHA makes it mandatory that offices have an exposure control plan. Every employer must have this plan to identify occupational exposures, methods of implementation, compliance with Hep B vaccination, hazardous communication, and making sure that this plan is updated on a yearly basis. So compliance with this includes universal precautions, which we discussed in the very beginning of this lecture. All patients have to be treated as if they have a contagious disease. It has to ensure that all team members actually take these precautions with, as we said, PPE and other workplace controls. So engineering and workplace controls, this controls that isolate or remove the bloodborne pathogens hazardous from the workplace, including PPE, proper hand washing and eye wash stations, as well as proper recapping of needles, and no eating or drinking, applying lip balm, handling contact lenses, things like that, in areas that may have blood, saliva, or anything like that that can expose a team member. Housekeeping management, as far as keeping the workplace clean and sanitary, is also important. And decontamination or removal of blood-soaked things, pathogens in physical areas has to be very prompt and immediate. So protective barriers and covers also have to be replaced after every patient. Receptacles that actually contain contaminated things must be decontaminated if used it again. Contaminated glass and things like that cannot be picked up by hands, but by mechanical means. Regulated waste such as sharps and other items that have been contaminated by blood or have the potential to leak must be transported immediately. Sharps, as we said, and Sharps injury logs have to be also kept within the premise and up to date as far as the date and time of any exposures and any Sharps that were involved. And you can read kind of what else has to be in this Sharps injury log. This is kept within every dental practice, as we said before. There are other regulated wastes or medical wastes that also have to be kept within the office. And this includes keeping regulated waste containers that are leak-proof, closable, and closed prior to any transport. They also have to be labeled, as we said, with a biohazardous sticker. Non-regulated waste that is not infectious can be actually discarded in an unmarked, unlined container. Contaminated laundry, as we said, has to be handled as little as possible in a closable labeled bag, and if wet, has to be in containers that don't leak. As we discussed, the Hep B vaccination has to be with all healthcare workers that come in contact with patients. It should be at no cost to the employee, and it has to be given at a reasonable place and time, performed by a physician that's under supervised care, and it has to be sent to an accredited laboratory. The employee has the option to accept or decline, but every employer has to offer it within 90 days, usually, of that team member joining the team. So post-exposure evaluation and follow-up. So if an exposure does occur within an office, you will see that there has to be in every office some sort of evaluation process. So if there's an exposure, it has to be reported to the employer immediately. And then it is up to that dental personnel to seek an evaluation and follow-up immediately. So usually there is an office that, a medical office that every team member has to go see if there is some sort of exposure. There's medical record keeping that also has to take place, including everything that you can see there as far as the employee's name and social security number, when they had their last Hep B vaccination or titer, all copy of examination results, and that has to be kept for 3 years in that team member's file. We also have to have training records that show that every team member was given the right to have training on OSHA standards as well. Communication of hazards to employees is also important, that everybody in the office knows what containers hold contaminated regulated waste and have, like I said, those biohazard labels placed clearly in fluorescent orange on those containers. Red bags or containers are also an acceptable substitute for warning labels. So as you can see, it is extremely important to use all the precautionary things that we listed to make sure that you're staying safe as a dental assistant in your workplace environment.